Imagine a medicine that can calm the storm inside the mind, a pill that can bring peace to someone battling schizophrenia, bipolar disorder, or irritability in autism. But at the same time, this very pill, Risperidone, has raised heated debates, from weight gain, hormonal changes to lawsuits in US pharmaceutical world. So the big question is Risperidone a miracle drug or a dangerous gamble? Stay with me because today I'm going to break down its story like never before, straight from a pharmacist's lens and also from the point of view of those working behind the scenes in US healthcare and recruitment. Welcome back to my channel, RxIndianPharmacist. If you are new here, consider subscribing to my channel. This is your go-to guide for pharmacy knowledge. I will share you insider stories that no textbook will tell you. The origin and rise of Risperidone. Let's rewind back to early 1990s. Janssen Pharmaceuticals introduced Risperidone, marketed under the brand name Risperdal. It quickly became a blockbuster in US psychiatry space. Doctors saw it as a safer than other older typical antipsychotics. With less risk of tremors, muscle rigidity, for patients, this was a breakthrough, a chance at normalcy. Risperidone prescriptions remain among the top in mental health care. That means jobs, nurses, clinical pharmacists, prior authorization specialists, and research roles are continuously in demand. The hiring ecosystem around this one molecule is massive. Let's understand the side effect story of Risperidone. But like every other pharma story, there is one flip side. The case of Michael, a 15-year-old boy in Texas who was prescribed Risperidone for aggression linked to autism. His mother noticed improvement in behavior, but within a year, he developed gynecomastia. Sadly, this wasn't rare. Thousands of such cases piled up, leading to multi-million-dollar lawsuit against Johnson & Johnson, the Janssen Pharmaceuticals. After every lawsuit, pharma companies re-strategize more compliance officers, more medical safety reviewers, and more pharmacovigilance specialists are hired. So side effects don't just impact patients, they reshape entire hiring markets as well. Behind the prescriptions, US healthcare trend story. Today in US, Risperidone is prescribed not just for schizophrenia, but also for off-label use like elderly dementia patients, though controversial. And here is the kicker. In many states, medical programs list Risperidone among their preferred drug because it's available in generic form and costs far less than newer antipsychotics. That means pharmacists and hospital systems and insurers are always looking for professionals who understand prior authorization cost, contaminant strategies, and patient counselings. If you are recruiting for those roles, you know Risperidone is one of the names that keeps popping up in the resume, job description, and patient case studies. So what are the takeaways? What you must know, actionable points for your viewers. If you are a healthcare worker, Risperidone is not going away anytime soon. Know it well. And if you are a HR recruiter in the market, like as in healthcare recruiter, demand for behavioral health, pharmacy benefits, management, and compliance roles linked to such psychotic drugs would get increased. And if you are a patient or a caregiver, always balance benefits with risk. Ask about weight, blood sugar, and hormonal side effects. So, Risperidone is neither a villain nor a saint. It's a tool. In the right hands, it can change lives. In the wrong context, it can cause harm. And that duality, that's what makes its story so powerful. So friends, if you like this video, consider giving it a thumbs up, subscribe to my channel, RxIndianPharmacist, for more useful videos like this. See you next week. Until then, bye.